Hi everyone, welcome to my channel. In this video, I will be talking about osteoporosis. If you found this video helpful, please give it a like, and if you want to see more nursing content, please consider subscribing to my channel. So osteoporosis is a bone disease characterized by low bone density leading to increased bone fragility. It's important to note that this disease is also both chronic and progressive. Osteoporosis is more prevalent in women than in men due to multiple reasons. Women tend to be at higher risk for osteoporosis than men due to their lower intake of calcium in their lifespan in comparison to men, their smaller body frames, earlier bone resorption, pregnancy and breastfeeding, and their relative longevity. The current guidelines to get bone scans for men are before age 70 or age 50 if they are at high risk for fractures, and for women before age 65 or earlier if they are at high risk for fractures. So this chart lists out all the factors that predispose a person to have osteoporosis. In general, diet and exercise as well as genetics and gender play a huge role in one's risk for osteoporosis. Other factors such as medications like long-term corticosteroids can increase a person's risk for osteoporosis. In normal bone metabolism, the rate of bone deposition by osteoblasts is equal to the rate of bone resorption by osteoclasts in a process called remodeling. However, in osteoporosis, the rate of bone resorption exceeds the rate of bone deposition, which then leads to less bone density, thus predisposing individuals to bone fragility. As I touched on previously, medications can interfere with normal bone metabolism, such as corticosteroids, heparin, some anti-seizure medications like Depakote, aluminum-containing antacids, and excessive thyroid hormones. So osteoporosis is typically apparent at the spine, hips, and wrists of an individual, so therefore you would see fractures or pain in these areas. In addition, you would often see spinal deformities such as kyphosis, which is basically a hunched appearance as a result of bone weakening. So this chart illustrates all the diagnostics involved with diagnosing osteoporosis, which includes an X-ray, any labs such as calcium, phosphorus, and alkaline phosphatase. It's important to note that calcium and phosphorus have an inverse relationship, meaning that when calcium is high, phosphorus is low, and vice versa. Bone mineral density measurements are also used to determine osteoporosis in individuals, such as a quantitative ultrasound and dual energy X-ray absorptiometry. In a QUS or quantitative ultrasound, sound waves are applied to the heel, kneecap, or shin to determine bone density, whereas a DXA measures bone density in the spine, hips, or forearm, which are typical sites of osteoporosis. Results from a DXA are reported as T-scores, which are standard deviations below average from normal bone density. In the chart, a -1 or higher standard deviation is normal. Anything in between -1 and -2.5 indicates osteopenia, and anything beyond -2.5 indicates osteoporosis. The XA values may also be reported as Z-scores, which are values in relation to the average of the individual's age or ethnic group. A value of 2.0 or less indicates a bone density problem. The treatment of osteoporosis revolves around promoting diet and exercise, as well as procedures and medications that serve to mitigate incidence of fractures and deformity. A diet high in calcium and vitamin D is encouraged, but it's important to educate patients to space out their calcium intake, as only so much calcium can be absorbed at one time. Also promote any weight-bearing exercise and facilitate patients to be as ambulatory as possible. Thoracic lumbar sacral orthosis, or a TLSO brace, are used to maintain spinal alignment after a fracture to decrease pain and deformity. Procedures such as a vertebroplasty and kyphoplasty are used to stabilize the spine but doesn't correct deformity after a fracture. This chart details the medications involved with treating osteoporosis. Estrogen therapy is used in individuals with osteoporosis as it inhibits osteoclast activity, though it's not primarily used due to its propensity to cause heart disease and certain types of cancer. Bisphosphonates such as alendronate or Fosamax are also used as they also inhibit osteoclast activity. Instruct patients taking bisphosphonates to take it with a full glass of water, take it 30 minutes before food and other medications, and to sit upright for at least 30 minutes after taking. Other medications like Prolia and Evista also serve to inhibit osteoclast activity. Forteo is a medication that promotes osteoblast activity and is the first drug approved for treatment of osteoporosis that simulates bone formation. And that is it for the video. If you found this video helpful, please give it a like and please consider subscribing to my channel for more content.